Hello, everyone, and welcome back to Burst TV. If you're new here, my name is Charlotte. I run this YouTube channel with some of my amazing colleagues and fellow dental professionals. I have two of them with me today, Marisa Park and Krismichelle Waller. Marisa and Chris have so graciously agreed to join me. We're just going to have a really real chat about working while pregnant. And, first, I just want to kind of get to know you guys. I'm Charlotte. I'm from Florida. I work on the marketing team here at Burst Oral Care. I was a dental hygienist for about 20 years, and I have been pregnant twice. I have two girls. They're a little bit older now. They're getting ready to both go to college. But I do have some very strong emotions about working while pregnant and some funny stories. And we're all going to share some of those funny stories with you later. Marissa, introduce yourself real quick.
Hi, I'm Marisa. I am from California. I've been a hygienist for over 15 years. I have two kids, one son, one daughter. They're 11 and 9 now. I got pregnant like 2 years into working as a hygienist. And then before, I went through some trials getting pregnant. And then before we were blessed with our rainbow baby, I also had a miscarriage. That was one scary dot like during working while working stuff. So that's it was a lot of challenges, but like from these what I learned so far is I hope I can share my story and help people too.
Thank you so much. And that's a vulnerable place to be in. We really appreciate you being here. Chris, on to you. Do you have some are you ready to share some news with us?
So I'm Chris. I'm in Texas. I'm going on 8 years now as a hygienist, and I got two boys, a 4-year-old and a 1-year-old, and we are expecting. So, so yeah, everything that we're probably going to talk about, I can relate for sure, right? Everything's coming back to me, but yeah, I'm happy to be here to share our experience together.
So you are in the throes of it, and I thought that was really important. I'm a little further out than you guys, so I do have my memories, but it's just amazing to have you here with us. As hygienists, we give advice for patients, the do's and don'ts when you're pregnant, diet suggestions, things that you should stay away from, importance of brushing and flossing, when to see the dentist, all those things. But when it comes down to it, we deal with the same pregnancy symptoms and the same challenges. And it's really easier said than done. So we are going to be vulnerable as we're sharing some personal stories. We're going to talk about the challenges that we've had and that anyone watching may have when you're going through a pregnancy. And then we're also going to give you some of our personal solutions, things that we've learned along the way to help with those challenges. So we're going to talk about eating. We're going to be talking about sleeping, oral care specifically, which is, we'll try to keep that brief, but that is our bread and butter, right? And then just working comfortably. We obviously have all been in the dental field. You spend a lot of time hunched over patients and sitting down. So we'll try to keep it broad enough to where anybody just working can still take away some really good nuggets. So first, we're going to talk about eating. Who here is dealing or has dealt with some really strong nausea, morning sickness type symptoms? The hand goes up. I thought based on a conversation we had earlier in the week that you would be a good one to talk about this first, Michelle. So tell us you're in your first trimester still, right?
Mm-hmm. Yes. Well, actually, you know what? I'm in my second. Beginning of my second trimester. So
Okay, cool.
I know everyone's different. Everyone either is never feeling the nausea, but for me, I'm lucky. I get to feel it. I felt it with both my pregnancies and now. So yeah, the nausea it's been it's been great. I definitely have to be careful what foods I eat, what foods trigger my nausea, and just trying to find solutions, especially when I'm working. So
Through all of your experience, have you really honed in on that one thing that helps prevent some of that morning sickness as they call it?
I'm still trying to figure out. I know I've tried the ginger, cough or no, someone had told me try the ginger candies, but
Yeah.
I couldn't I couldn't do the ginger because that was kind of gross. But I have done like ginger tea and like certain teas, like herbal teas has helped a little bit with my nausea and just drinking lots and lots of water and liquid IV those little packets are
Oh yeah,
really
good.
nice. So those have helped a lot.
Usually people think of those as like after you've had too much, when you're
Mhm.
out sick. But I never even thought of liquid IV. Well, we didn't have it at the time. Pedialyte
Mhm.
was the closest, I could
Yeah.
get at the time. What about you, Marissa? Did you deal with a lot of morning sickness, nausea?
With the two pregnancy, the first one I didn't have any, so that was kind of weird, right? And then the second one, was everything, smell, food, like I was just nauseous until like second trimester. So what helped me was like snacking. I had to snack a lot during the day, so I had crackers, I had nuts and stuff, like any like nothing too like fragrant. Like aroma stuff, because that made me even more nauseous too. So like plain, like saltine crackers, peanut butter sandwiches, like, and I had gestational diabetes too, so I had to watch what I eat. So it's like nauseous and at the same time.
People have odd cravings, and as much as hygienists we are, sometimes you just have to eat what feels good to you at that time. And so my best suggestion would be when you have those cravings, I would just eat the things that I could keep down, and then the really minty sugar-free gums. If I couldn't drink the water because it was making me feel a little off, I would at least swish with it to get it out of my mouth. And I have recommended to people use baking soda with water or a little bit of salt water swish. And then if you are high risk for cavities, then talk to your dental professional and see if they have a prescription paste that you can use at night just to kind of balance things out and offset all the bad habits that you might have short term. Did you guys have any other habits that came along, like chewing ice or chewing on pens or anything like that?
Not before and not recently. I don't
Yeah.
have any. Mm-mm.
We probably have all just been taught not to do that,
Yeah,
right?
that's probably why.
Really, we probably just avoided it even if we thought to, but that's really common. So if there's anyone
Mhm.
listening that really craved ice, drop that in the comments and tell us, a little bit about that. It's very normal. Sometimes that is an indication that you're not getting some of the nutrients, that you're having those really hard cravings like that. Some pregnant women have even, um, this is going to sound really odd, but they've craved dirt or things with minerals. Like you innately crave things that your body needs. So for me, it was oranges. Thank God it wasn't dirt, but chewing ice is pretty common. That's really normal.
That's actually a good point because, I mean, they say people who do chew ice or experience wanting dirt are usually anemic. And when you're pregnant, yeah, you do have low iron. Like, I know I'm going to have to take a lot of iron during this pregnancy. They gave me iron supplements during my last pregnancy. So, but I haven't experienced tasting dirt or anything like that. But ice, cold water, yes, but not chewing ice.
No, yeah, no chewing ice. Awesome. So let's move on to sleeping, which is another challenge in a variety of forms throughout your pregnancy. Early on, you're excited, but as things progress, you start to get more and more tired. I felt by the end, people were like, "Let's just get this baby out of here." Chris, any solutions that you could think of, or like just little tips throughout the day that people could use when they're so sleepy?
Well, I just discovered, there's natural things that you could do. Like there's drinking tart cherry juice, apparently because it has natural like melatonin and it has like other things that help with like promote sleeping. And also I think adding magnesium glycinate. It's all over TikTok. Apparently there's a sleepy girl mocktail. But I mean that, and also I've been told just make sure you're drinking water. I'm trying to think right now. I'm with two kids, it's a little hard to to get the sleep that I want. But yeah, I'm definitely gonna try the tart cherry and see if that helps with my sleeping.
Yeah, I think
So
that really comes down to like getting good quality sleep at night so that
Yes.
you're not so tired during the day. What about you,
Hmm.
Marissa? Did you get real sleepy? Like, how did you deal with how tired you were while you were working?
Well, I take naps. So like before, like I'll take walks, but then when I was really tired, I actually like utilized the dental chair and actually took naps on there because like it's so comfortable. You can recline it a certain way, and people can like they're like you were snoring in the room. I'm like, oh yeah,
Yeah.
how tired I was. But yeah, I usually anytime I get a chance, I will take a nap in a chair. And then like even at home, getting like a good pregnancy pillow, where you can position yourself
Yes.
where you're comfortable and stuff like that way you're not like that you can sleep better that way like getting good airway too because I
Yes.
noticed I end up I was diagnosed with like sleep obstructive sleep apnea when I was pregnant and I was like trying to get the oxygen and so I tried a pillow to help me elevate better.
Nice. Yeah,
Hmm.
it's
That's
funny that you
important.
should mention snoring. You set me up perfectly for this one because I started snoring like to the point, and I'm a light sleeper, but I just continued to wake myself up, which was causing a lot of dry mouth. So I had to change a few things. I usually would sleep on my face, on my stomach, but you can't do that when you're pregnant past a certain point. So I had to learn to either prop myself up with some pillows, lie on my
Hmm.
side. And really, one of the few things that you can take when you're pregnant, because I was so stuffy, having a really hard time breathing through my nose, Sudafed was about the
Oh
only thing
yes.
down. We're
Hmm.
not here to give medical advice on what medications you should take at all, but for me personally, my doctor said that would be fine. And then dealing with the dry mouth, which I still deal with that a little bit now, I had to keep something at my bedside just to take a little swish from time to time. Vaseline on the lips, if you ever deal with dry mouth, a little Vaseline on the lips helps keep your lips from doing this, which is super attractive and dries your teeth out like crazy. So
I put vapor rub too like on your chest because I had
Oh yeah.
so vapor
Hmm.
rub so I can like clear my breathing and stuff so I don't breathe in my mouth like sleep with my mouth open sometimes.
I still do that when I have a
Hmm.
stuffy nose. I'll put Vicks Vapor Rub right here, and then I'll wear a mask. And thankfully we've been in an industry where we're used to wearing masks all the time, but it kind of kept the warm air in, and those vapors really do open up your airways.
Mhm.
Did you guys have crazy dreams? That was one thing that toward the end there, I did have when I was in that nesting phase. I did have some pretty violent, pretty realistic, colorful dreams. We've heard stories of people wanting to hurt their husband or having arguments with
Oh.
him in their dreams. Have you guys had any experience with that?
I can't. I've definitely had vivid dreams. I can't even remember what they were about, but I just remember like near the end of my pregnancy, like I hardly dream because
Yeah.
I'm really deep sleeper. But yeah, I remember having like some pretty crazy dreams, and I tell my husband like, "Yo, like, you can't believe what just happened."
I remember this one I dream that I had like my mouth like I can see the bacteria on my teeth and stuff. I don't like
Oh,
him.
that's wild.
It's like I'm looking in a microscope and I see my mouth and all that stuff. Like I'm not taking care of it and stuff because I did have some pregnancy gingivitis. Like I flossed and I did everything, but I just had a little bit of it. So I think that's what one of my fears. So that's like I can't get that out of my head. I still remember how it looked, like eating my teeth away and all that stuff. It's
Yeah,
like
Oh,
that is a nightmare for a hygienist, definitely. My goodness. So we'll try to keep this brief when we're transitioning into oral care in general. I'm just gonna kind of rapid fire a few issues that a lot of us will have when we're pregnant. And I'm just gonna ask you like what's a good solution for that? Chris, gag reflex.
oh gosh. I guess just taking little breaks for me, especially right now, because we encourage everyone to brush at least for 2 minutes. But for me, it's been hard, especially when I want to brush my tongue, because your tongue is important. You're having dry mouth, like Charlotte said. So you just kind of have to push it out. Sometimes I breathe out or I'll hum to like help clean my tongue. So at least I know I'm like getting as much bacteria off out in my mouth. So that helps. Just trying to
And I also
mentally.
we gotta plug. an electric toothbrush that does more for you. If you've only got like 30
Yes.
seconds of time before you feel like you're going to throw up, an electric toothbrush is your friend.
Yes,
What about you,
absolutely.
Marissa? Any other tips for gagging?
Well, I think it depends. Like you might have maybe like the toothpaste, the taste or something. Because I didn't like toothpaste, and I just couldn't use it anymore. So I just brush with water. Like that's still clean, you know. So I just avoid like mint toothpaste. I couldn't find anyone that I didn't have. I wasn't gagging with and stuff. So I was just like baking soda and water. That's all I used. Mhm.
That's awesome. I'm going to take vomiting because I had morning sickness for a good 2 months, and I threw up a lot. So what I found that is really important is just trying to swish with water. Even when I was talking about dealing with nausea, trying to switch with water, using some baking soda and salt water, really staying away from things that you might be prone to go for, like the rinses. We won't name any names, but if it's got a lot of alcohol in it, it might taste good to you, but that can actually be counterproductive. And one tip that a lot of people watching might not know is that you don't really want to brush your teeth right after you throw up, because your teeth are weakened to a certain extent. The pH drops tremendously when you've got stomach acids coming up. So you really just want to rinse away all the gook. So maybe rinse hard with water and then pop in a sugar-free gum that you like the flavor. It could be orange, it could be mint, whatever feels good to you at that time, and just keep them on hand all the time. And then just know that it's going to eventually pass for you. um, this was an interesting thing when I was doing just a little bit of studying up on common questions that people have. People were Googling, can your teeth get loose when you're pregnant? This is kind of twofold, and I thought it was a good tidbit. Teeth do actually become temporarily loosened when you've got elevated levels of progesterone and estrogen. So if you just move your tooth a little bit, it's almost like when you're
Interesting.
an ortho. It's got a little bit of movement there, as long as you're brushing and flossing and you aren't already in a state of periodontal disease. Definitely see your dentist if you feel like this is not within normal. But it can be expected for some people to notice that their teeth are moving around a little bit just in during that time. And it's related to it, but pregnancy gingivitis is very common. Chris, have you experienced any of that with your pregnancies?
I've never experienced, but I've seen it in my patients who are pregnant and their gums are really, inflamed, and they'll have like the signs of the pregnancy gingivitis and all that stuff. So I always try to, give them some home care solutions to help, floss, like you said, use a rinse that's, no alcohol in it. But yeah, I try to help them out because you're in a very fragile time. Your mouth is very fragile right now.
So I'm just going to take a shot in the dark. In all your years, have you ever kind of on the lowdown? We can't diagnose medical conditions, but have you ever caught someone being pregnant when they hadn't told you?
Yeah. I did. I'm like, oh, because like we see our patients so often, right? And then stuff like that. So then, and from like not bleeding that much to more, and then even sometimes their gums are a little bit more inflamed, and then it's like, or like one like papilla, so one of this patient was a little bit more like it's like more like circular and stuff. It's almost like a pimple in us. So it never happened to her before. So I'm like, oh, this is interesting. Like, when do you notice that? Like, have you noticed that lesion before? Like, does it hurt? And she's like, no. I'm like, well, it could be, hormones and stuff. And I'm like, so I'm like, do you feel like nauseous or like just like questioning, right? Just building rapport. And she's like, yeah. And she's like, I was about to go take a pregnancy test and stuff.
Wow.
I'm like, yeah, it's crazy. And then she was pregnant. She can't like she told me later. I'm like, oh my gosh. But no, you can tell sometimes with gums and it's like it's just a certain color and texture too.
Mm-hmm.
Hmm.
Yeah, and I think that's important for people to understand too. Is like dental professionals, dental hygienists, we've been trained to recognize when things are in a normal range and when they're not. And you really get to know your patients. So when you see like even eyeballs that are yellow might clue you into some other medical conditions. If you notice that blood pressures are off or tissue looks different, a lot of times we can help patients find out what might be ailing them before they're even clued into their symptoms, because there's a lot of telltale signs.
Mm-hmm.
So let's move on to working while you're pregnant. We're going to talk about this on other social channels as well. Um, Backaches are really common, especially as you progress into the later stages of your pregnancy. What do you guys suggest for backaches? Just working more comfortably during the day.
Stretching. I do a lot more. I'm now, I guess, after two pregnancies, and now I'm like, okay, I know what to expect and how to take care of my body better. So I always try to do, even if it's just like little stretches, especially your hands, but especially your back. I try to do like, yoga stretches before I go to work and then after, and then when I get home. So my body's kind of reset for the next day. Because yeah, we're hunched up most time. I mean, we shouldn't be hunched over, but sometimes we're in some really not ergonomic positions.
I mean, I like the brace, like my back brace, like the
Mhm.
thing that wraps around your stomach, kind of like holds it up too, just to give it some more like.
Now, did you have one that actually lifted your belly a little bit? Oh, nice.
Oh,
Never
nice.
tried that. Yeah.
That it felt so comfortable because I felt like I carry my baby a bit lower too, so like even when I'm walking to get my patients, I'm waddling and stuff. So I'm like, I need somebody to hold it up, right? So it helped me with my back and my stomach, everything. Like it kind of made me sit up straight a little bit, like sit up more straight instead of hunching and stuff.
Yeah, I never tried that. I did definitely stand up more when I was working, just because my back started to really hurt from sitting in this position. And so I would usually switch. I'd see one patient standing up and then I'd sit down for the next. And speaking of standing up, that also helped with just like the swollen hands and feet, like trying to pick my feet up in between patients, or writing notes. I think no matter what industry you're in, if you have to sit down a lot, see if you can stand up for part of the day, standing desk even, or if you're standing up and you're on your feet, try to, you know, take a break, vice versa. Brain fog. So this is something that, like, if you have the kind of job that you're doing the same thing, it's very routine day after day. Um, that's a little bit easier to handle, but I just want to let everybody out there know that, like, brain fog is a real thing. And once it kicks in, you might not get that back until 6 months after your baby is born. So if you feel like you don't know what day it is, or you're like not remembering certain tasks, like, it's okay. We've all been there with you. You guys have any stories to go along with brain fog, or what could you possibly do to prevent that?
I don't think it's preventable.
Yeah. I don't think
Exactly.
there's a solution. I think you live
Sorry,
with it.
happens. I thought I would just pull the crowd here, because that was definitely my thought too. Is like, there's just nothing around some of those things. You're gonna have you're gonna have backaches. You're gonna probably throw up. But you just try to offset those negative things with all the positive things. And pregnancy itself is just, it's such an amazing time. I want to finish off with just some funny stories. It is story time. I'm just gonna do a little start with Marissa. What's the funniest story you can think of when working while pregnant?
Well, for me, like I was really big. Like they thought I had twins, but I only had one. So like I had to like there had like beginning when I had to put my stomach where the patient lays down where the headrest. My stomach will be on a headrest. I'm sorry. Like I have to put this here and if something kicks you, I'm sorry. But like they're like, oh, it's okay, it's okay. So I had to like scoot my patients down just a little bit just to make room for my stomach.
I did actually well, I didn't. My oldest daughter kicked someone in the head once. My funniest story, and this is gross. Like, turn away if you don't want to hear this one, because it still sets me off a little bit. I was already having a very ill morning. I didn't get a good breakfast, so I was already feeling a little nauseated. A gentleman with a handkerchief comes in, and he's snarfing, we'll call it. A lot of clear in his throat. And during the appointment, he did blow his nose into his handkerchief and put it in his pocket, which I was fighting it back. I was really proud of myself for like not losing it then. And then midway during the appointment, he did one of those and he grabbed the suction out of my hand, the little slow speed, and tried to deposit this phlegm ball into it. And all we got was a big ropey, I have a hard time thinking about it. Yeah, so it dribbled kind of like on his bib, and I didn't watch the rest of it. I ran. Thank God I was right next door to the bathroom. I threw up so hard and so loud, and I was non-apologetic about it. I rinsed my mouth with Listerine once I got back in there because that's just the first thing I thought of. And he's like, "I'm so sorry. Were you okay?" And I was like, I'm pregnant, and that was too much for me. So we're not going to do that again, okay? We're gonna really try to calm that phlegm situation down." And I was just,
Oh,
your face is all a mess. You're crying, half crying, the snot coming out and everything. So it was just, he was very sweet after that. But yeah, that's my story.
that is really sweet. I was telling the girls, I haven't had like a crazy, I don't know, unless this is the year I'll have some crazy stories, but mine are more like, I guess, postpartum. So, I was breastfeeding and we're at a time where now we have portable pumps. So I wouldn't tell my patients I'm pumping because I felt like that was just kind of, "Hi, my name's Chris. I'm going to be pumping while during your appointment. Hope you don't mind." But so I would just be pumping and they're just like mid appointment. They're like, "What's that sound?" I'm like, "Oh, I'm pumping water. No, milk." So it's just awkward.
That's so great though to get different reactions. I'm sure people were
Yeah.
either like, "Oh, okay," or
Yeah.
"Wow, that's amazing." I,
So,
I didn't. The pump that I had back in 2003 was like the size of a small suitcase, like an attaché or whatever, and it was brr, 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 and it was connected to very obvious tubes and like super messy. So yeah, I just had to hang out in the bathroom for 15 minutes at a time, and everyone that walked by the door knew what was happening. So I did get my privacy. All right, ladies, everyone for watching. Thank you so much for joining us. We had a lot of fun. I hope that you guys feel better if you are also going through some of these pregnancy challenges. But more importantly, I hope you had a couple little tips. If you found something that was really useful to you that you think, "Oh, maybe I'm going to try that," put it in the comments. Let us know what other kind of topics you would like us to talk about. We are here to help support you. So let us know. And thank you so much for watching Burst TV. We'll see you next time.